All right, so now we're going to begin our discussion on system terminology. So, what you see here is the basic anatomy of the urinary system. We have the kidneys, where essentially all the filtration happens. We have the ureters, which are a transportation component to bladder. Bladder stores urine. And then we have the urethra and the urinary meatus, is where urine will actually leave the body. So, function of the urinary system: going to remove liquid waste material from the body. It's going to help regulate fluid volume via substances that have effects on the cardiovascular system. Electrolyte concentration in body fluid. Essentially, these two functions are heavily related, especially when we talk about potassium. It's going to assist in blood pressure regulation, which again directly tied to the fluid volume. So, gender differences in the urinary system. This, along with the reproductive system, is where we'll see the gender differences. In the females, urethras are only about 1.5 inches long. In the male, the urethra is 8 inches long because it has to, again, wrap around the prostate gland and follow through the penis. So, because of these differences, what gender is going to be able to contract a bladder infection more easily? Be females. So, combining forms about cysto, bladder, hemo or hemato, again, blood. We've done this one before. Hydro is water. Litho is stone. Meato or meatus or an opening. We've talked about the external auditory meatus previously. We have reno or nephro. These refer to the kidney. They have very subtle differences on when they'll be used. Then we have noct or nocti for night. Oligo is few. Hyalo, talking about the renal pelvis specifically. Pio is plus. Uro refers to not just urine, but the urinary tract in general. We have uretero, which again, ureter, and urethra. So, going through here, nephro, talking about the kidney. All of these are outlined here. Thing you might not know yet, the renal pelvis is going to be this general area here. From the outside of the kidney, area that's a little indented where the ureter essentially connects, where all of the actual filtrate kind of flows to kidney, because each of these, what are called pyramids, is kind of where the actual filtration of fluid happens. And specifically, it's at the nephron. Suffix is emia. Again, blood conditions. I already know this one from the system. Gram, recording. Graphy is the process of recording. Iasis is just a general term for condition. Plasty is a surgical. Trypsy is the crushing, something like lithotripsy. So cystoscopy, cystogram, cystography. These are all things that we be comfortable differentiating these suffixes. So what you see here, picture, we have a X-ray, and via a catheter in the urethra, the bladder has been filled with some sort of substance that allows us to see the actual bladder itself, and we can get an idea any deformities, as well as an idea for the volume of the bladder, etc. So again, remember, a gram is the recorded image. So a cystogram is the image of the bladder. Graphy is just the process. So cystography is imaging process to create this image. So again, these are all suffixes, specifically surgical suffixes, that we should really already be comfortable with by this point, especially the difference between tomy, ectomy, and stomy. Really, tomy is just generally to make an incision. Ectomy is the actual excision or removal. Stomy is just a general term to create an artificial opening. Okay. What might be new here is pexy, and that's a term for surgical fixation. So you want something to not move, have to fix it, or essentially suture it. So, and all of these here, again, we've covered these in the cardiovascular system, but they are going to apply here, especially with the kidneys function in blood pressure and blood volume relationship. So, looking at these terms, these are conditions referring to urine, and each of these prefixes are specifically referring to modify. Anuria is without urine. Dysuria is, in our case, we'll use dys as painful. Hematuria is just blood in the urine. Nocturia is a good one because it specifically is implying to talk about excess urination at night. Okay. There are certain conditions where people will have problems potentially holding their bladder at night. This is normal in young children, but it's not normal as an adult. Signify another type of condition. Oliguria is just reduced amount of urine. This can be a concern and could signify something dehydration. Pyuria is just pus in the urine. That's going to signify an infection somewhere in the urine tract. So, again, conditions we've already seen. Cystitis. Remember, cyst in our case of urinary system, we're talking about the bladder. Cystitis is a bladder infection, typically referred to as a urinary tract infection, but a UTI can essentially be a term used in the urinary tract. Cytolithiasis, this or cystolithiasis, this is just a bladder stone. So what you see here is what cystitis actually looks like. Bladder, how it's red, relatively inflamed looking. And again, your urinary tract infection, cystitis is one of the UTIs that can happen. We can also get a urethritis, which is just itself, or you can get something like a nephritis or a pyelonephritis, which up in the kidney itself. Again, bladder stones, they behave just like stones that we talked about in the digestive system. This is a cystolithiasis, right? So referring to cystolith as a bladder stone itself, but then iasis is a suffix to indicate condition. So again, you're looking here, nephrolithiasis. This is a kidney stone. Gadotomy, pyelonephritis, urea, renal, uremia. Again, pyelonephritis is another type of infection in the kidney, and we see a picture of it here. On the left is a normal kidney. Now, that kidney is actually upside down. This would be the ureter here, the renal pelvis. So you can see it being very exaggerated over on this side. Ureterectomy, again, removal of uretolithiasis. This stone in the ureter. This is typically the part of passing a kidney stone that is painful. If I could speak, ureteropolionephritis. So again, it's just pyelonephritis. It's involving the ureter as well. Cystitis, urologist, urology. And again, urethrocystitis, a urethra and bladder inflammation. Again, these are more procedures. Should all be very familiar by this point. You see cyst, you talk about bladder. You see urethra, you talk about a urethra. You see retro, ureter, or renal, or nephro. We're talking about all we're doing at this point is just adding more diagnostic terms to them that we've covered week in, week out at this point. So this is artificial opening into the kidney. What is the artificial opening? Stomy. So nephrostomy is to create an artificial opening into the kidney, and this can be done in situations where urine building up in the kidney needs to be. What we see here is a pyelolithotomy. So again, this is a condition of stones in the pelvis that are being removed via an incision. So this is a tomy, specifically making an incision, whereas a stomy is just an artificial opening. Okay, so if we were to go back and perform a nephrostomy, we're essentially making an artificial exit point that is going to stay an exit point. So a percutaneous pyelolithotomy. This is again through the skin, meaning which is where we get percutaneous from. And we're just going to be removing stones from the renal. So again, the same thing is going to apply here. A lot of what we see is about cutting into or moving. A fun one, lithotripsy. So lithotripsy is a procedure where we actually utilize really basic trigonometry and can put sound waves for certain types of kidney stones, for instance, and they can be broken up by those sound waves. It's very interesting. It's a non-surgical procedure. It can be painful, and people are given very light sedatives as part of it. But again, it's non-surgical, and it's not a guaranteed cure to it like a kidney stone. But again, non-surgical, so it's a much better option. So going through here, more terms. We got chronic kidney disease. Just referring to a long-term dialysis. So dialysis is basically where a person has poor functioning kidneys, and they essentially are attached to a machine, and that machine will do the function of itself. Okay, and it's important to be able to remove specifically nitrogenous waste from the nitrogenous waste is literally the waste that's left over from everything that is like a protein, especially any proteins that get broken down. The waste product of that has to go through the kidney. Extracorporeal shockwave lithotripsy, that's literally what I was just discussing. Incontinence is the inability to consciously prevent urination. Urinary catheterization is to just put a catheter up urethra. And then voiding is one of the ways to describe the act of urination. Physiological term for urination is micturition.